this little glider burrito has a problem, and we're going to take a look at it in just a second. We'll put an overlay up so you can see a close-up. But this little guy is very thin, and he had stopped eating when he came in. His body condition is pretty poor. You can see all of his spine and his little hips here. He is an intact male. He also has a mass at his scent gland on his chest. You can see the swelling here and secondary skin infection there. It's very common to see yeast infection. And more importantly, he has a very common problem that we see in gliders. Any idea what it might be? So in sugar gliders, it's almost always related to nutrition. Nutritional issues are a biggie for them. Your nutrition, if you own a glider, needs to be spot on. Two things you should focus on if you have gliders. Number one, they can never be kept alone. Number two, they need excellent nutrition. And it's really important to do your research and understand what their needs are and make sure we meet those needs. They will unfortunately develop pretty severe disease and immunosuppression and will die with poor nutrition. Very commonly in gliders on questionable nutrition, we'll see immunosuppression, generalized yeast infections on the skin. And the problem that we're specifically seeing with this one today is he's broken both of his upper incisors off, and the upper right incisor is discolored, it's yellow, and it's thickened, it's blunted and abnormal. And so often what happens is a calcium imbalance. The calcium will weaken the periodontal ligament. The teeth will shift, we'll get an abscess and infection at the tooth root, and they start losing teeth or abscessing teeth. And that's one of the concerns for this little guy today. So an important note if you have gliders is this is entirely avoidable. So what is excellent nutrition for gliders? In general, I'll recommend the Wombaroo diet. I've had a lot of breeders that have used that diet and they seem to do well. And no, it's not sponsored. I'm not an advocate for the diet. I've just seen gliders that do well on it. It's very important if you have gliders that you ensure that their diet is adequate in calcium and supplement their calcium. Low calcium levels will frequently lead to this problem, and very frequently I'll see weak gliders that come in for shaking or seizures or literally falling to the bottom of the cage, and that is almost always related to a calcium imbalance and malnutrition, and again entirely avoidable. The takeaway, if you have gliders, do your research on nutrition. There's extensive knowledge out there. What we used to use is Leadbeater's mix. That's still a very good one. One of the commercial ones that I'm familiar with is Wombaroo. There are others that are good diets as well, but do your research and never keep a glider alone. They must be housed with other gliders. The plan for this guy is we have started him on calcium supplementation. We're treating for secondary infection. He will need a dental for that tooth. And then we're running a fecal to check for parasites because gliders will get parasites, including Giardia.